back to Zotec Answers, where we break down the policy and technology shaping the business of healthcare. In the last episode of our AI series, we talked about how AI is already showing up across healthcare, and in many cases, without formal oversight. Today, we're continuing that conversation by looking at what happens when AI, patient behavior, and data privacy start moving faster than the policies meant to govern them. And the question we're answering today is, as AI expands access to health data, who's actually responsible for protecting it? I'm Jennifer Fox, the Director of Communications for Compliance and Advocacy at Zotec Partners.
And I'm Megan Applegarth, Manager of Client Advocacy and Government Affairs at Zotec. So I think the easiest way to frame that is that healthcare privacy rules were built for a very different environment and a time that we're living in now. So HIPAA was designed around health data that largely stayed within the more traditional healthcare settings, such as doctors' offices, hospitals, and even health plans. But today, that same information is moving more freely through apps, wearables, and AI tools that exist very far outside of those traditional healthcare settings. So that's where things get more complicated.
Exactly, because at that point, it's not necessarily clear who's responsible for protecting the information anymore. So that's why this whole conversation feels a little unsettled at the moment. The same health information can end up being treated very differently depending on where it exists and who's using it.
Exactly. And to make matters even more complicated, there isn't always one clear authority who's overseeing all of this. So when you look at regulation and governance, different agencies are involved, some states are involved, and the rules across all of those things rarely align. So instead of one consistent framework, organizations are trying to navigate a mix of expectations that are continuing to evolve in real time.
And that's especially true when we're talking about governance at the state level. What's interesting right now, though, is that states aren't just talking generally about AI anymore because they're targeting specific healthcare issues. And you're seeing states like Alabama, Minnesota, Wisconsin, Michigan, Massachusetts, even California. And they're all taking different approaches to regulating AI in healthcare, particularly around prior authorization, claims processing, and clinical decision making.
Yeah, and I think that really shows where lawmakers are most uncertain right now. In some states, there's an effort to limit AI use in prior authorization altogether, and others are saying that AI can support the process, but licensed clinicians still need to be responsible for those final decisions. So there's a broad spectrum there for sure. And then we have states like California who are focusing more heavily on transparency, requiring disclosure when AI is involved in patient care, and reinforcing that clinicians can and often should override AI recommendations.
Yeah. And even though the approaches are different, the bigger theme feels pretty consistent. Lawmakers are trying to figure out where AI can support healthcare and where human judgment is imperative. Because once AI starts influencing decisions tied to treatment, coverage, or access to care, well, it stops feeling like just a technology issue and it becomes a much bigger conversation about oversight, accountability, trust, and eventually liability.
Yes, exactly. And right now, different states are answering those very questions in very different ways. Some are trying to encourage innovation, while others are more focused on putting guardrails in place first. But while policymakers are still trying to sort all of that out, patients are actively using tools in their everyday lives, which adds a completely different layer to the conversation around privacy and data use.
Right. And it's because at the same time, patient behavior is changing just as quickly. People have more access to their health information than ever before, and they're increasingly sharing that information through apps, wearables, AI tools, often without thinking too much about where that data actually goes after it leaves their healthcare system.
Exactly. And that's where the privacy piece becomes much more complicated because once someone enters health information into a consumer AI platform, most of the time those protections look very different than they would inside your doctor's office or hospital system. So it gets tricky because even if the healthcare organizations are following the rules, the data itself can still move into environments that operate very differently.
Which really gets to a bigger issue that's underneath all of this. The healthcare system was built around the assumption that health data mostly stays inside traditional healthcare settings. But increasingly, that is no longer how people interact with health information or technology.
Exactly. And I think that's part of why there's growing pressure for some kind of federal framework, even if it still unfortunately feels a long way off. Congress has a few bipartisan AI task forces and committees looking at things like transparency, consumer protection, and oversight, but there still has yet to be one clear, unified national direction on any of it.
Meanwhile, states are continuing to move ahead on their own laws and frameworks that are focused on the needs of the people in their states, which means healthcare organizations aren't really sitting around waiting for one national standard to emerge. They're adapting in real time as different states create different expectations around AI, privacy, and oversight. And honestly, even if Congress eventually does pass broader AI legislation, which I'm sure they will, it probably won't make everything simple overnight. Healthcare organizations would still likely be dealing with stricter state laws layered on top of a federal framework, assuming federal legislation doesn't ultimately preempt those state laws in the first place, especially for organizations operating across multiple states, like healthcare systems, physicians, locum tenens, and physician practices.
Exactly. So, this patchwork approach may be something organizations are navigating for the foreseeable future, unfortunately. And I think that's what makes this moment really challenging. The technology is evolving every day, it's evolving so quickly, but the regulatory environment is around it is sort of evolving in pieces rather than all at once.
Yeah. And we're seeing the federal government take a lighter touch approach in some of these areas, focusing more on voluntary collaboration than formal regulation. One example is CMS's Health Tech Ecosystem Initiative, which is aimed at improving interoperability and making it easier for patients to digitally share health information.
Yeah, and that may end up being the most realistic short term approach, especially given how quickly the technology is moving compared to policy. And at the same time, programs like the WISER model are showing just how complicated these questions around oversight and accountability can become once AI starts playing a larger role in healthcare decision making.
All of this is why I think these conversations are getting so much attention right now because, once AI begins influencing coverage decisions, physicians naturally start asking questions about how the decisions are going to be made and ultimately who is responsible for them.
Yeah, so when we take a step back from all this, the picture gets a little bit more clear. Health data is no longer staying inside traditional healthcare walls. AI adoption is moving quickly, and policymakers are still trying to figure out where the guardrails should be and what they should be, which means healthcare leaders are navigating a landscape where the technology, expectations, and regulations are all evolving at the same time and at different speeds. And the organizations who are paying attention now, especially to state level activity and changing patient behavior, are going to be in a much stronger position moving forward.
That's true. So, we're going to continue to follow how this evolves. And if you have any topics that you would like us to cover, please email us at zotecAnswers@zotecpartners.com. Until next time, stay informed and stay engaged with your lawmakers.